Hello everyone, my name is Sepide and today I'm going to talk about my RAP project. So the patient is a 34-year-old Hispanic female. She's seeing her physician every year. She did not have any surgeries and she was not hospitalized in the past 5 years. She's not currently taking any medications. However, in general, she's allergic to amoxicillin, clindamycin, and erythromycin. She also has latex allergy. Her BMI is 31, which put her in obesity category. She has a family history of hypertension, diabetes, and kidney disease. Her blood pressure was 120/80, pulse was 76, and respiratory was 14. Her ASA status is 2 because of antibiotic allergy, latex allergy, obesity, and also blood pressure because the diastolic was 80. So the patient has a chief complaint of pain and sensitivity on tooth number 2. Her last dental visit was a month ago for SRP of upper right quadrant, but in general she's not visiting her hygienist that often and she does not have any history of periodontal surgery. Her oral hygiene status is fair. So here is the FMX of the patient. Patient has pocket depth of 4 to 5 mm in the posterior teeth. However, in the anterior teeth, the pocket depths were mainly 2 to 3 mm. There was no recession, no forcation, no bleeding on probing. The plaque index was 45%. The Vestaley College calculus code is medium. The AAP classification is a stage 2 periodontitis because of the generalized horizontal bone loss that is mainly 15%, the probing depth that are 4 to 5 mm, and the cal that is 4 mm, and the crown to root ratio is 1 to 2. For the intraoral examination, the patient had bilaterally linear alba on her buccal mucosa. Her gingival description was pigmented, stippled, firm, and blunted, both for maxillary and mandible. She had pigmented tongue, fordyce granules on her lips, and she also has discoloration on maxillary anterior palatal teeth. She has attrition in posterior teeth due to excessive grinding. The extraoral examination were within the normal limit. The patient occlusal classification was 2. Her maximum opening is 45 mm, overbite is 3 mm, and overjet is 4 mm. She had open bite in the posterior teeth. Her facial profile is mesognatic. She also does bruxism, cheek biting, and grinding at night when she's asleep, and she has attrition in the posterior teeth due to grinding and bruxism. First appointment was assessment, so reviewing medical history, extraoral and intraoral examination, caries inspection, periodontal assessment, and intraoral photographs both before and after the disclosing solution, and also diet analysis. For the second appointment, it was mainly focused on instructions, so discussing the medical status, nutritional analysis, fluoride analysis, going over camera, and oral hygiene instructions. The third appointment was scaling and route planning of lower right quadrant. I was only focused on that specific quadrant because the other quadrants was supposed to be scaled by the seniors. The fourth appointment was the re-evaluation appointment, which was the periodontal assessment, nutritional feedback, intraoral photographs, and reinforcing oral hygiene instruction. Some of the recommendations I gave my patient was occlusal gulp because she's grinding her teeth and she has attrition due to that. And I also referred my patient to dentist because she said that she has sensitivity and pain on her tooth number 2. And also I recommended her to get sealants for the areas that they had deep pit and fissure, and fluoride varnish after the dental hygiene treatment. Patient plaque index was 46%. The patient brushes once a day with a power toothbrush. She's not using a fluoride toothpaste, and she's not flossing regularly, and she's not using any mouth rinse. For the oral hygiene instructions, I recommended my patient to brush at least 2 times a day for at least 2 minutes using a Bass method technique. flossing at least once a day, using a C-shape technique, using a tongue scraper and rubber tip, water pick to clean the interproximal areas, and I recommended my patient to rinse her mouth with ACT mouth rinse daily and choose xylitol gums to reduce caries. After Cambro assessment, patient was placed in moderate to high risk of developing caries, so I recommended her to minimize the use of sport beverages and sodas and also rinse her mouth with water after drinking soda to reduce excess sugars and acids from her teeth. I also recommended her to reduce snacking between her meals and use a fluoride toothpaste. Some of the progress that the patient had in her food diary was improving in vitamin C intake, fiber intake, and vitamin A intake. However, her calcium consumption was reduced. The patient stated that she's now drinking more water, she's consuming more vegetables and whole foods, and she's also exercising 45 minutes a day. The plaque percentage was the same, however, less plaque was shown in the area that I scaled. The patient also stated that she's doing a better job at her home oral hygiene care and she's wearing her night guard and she already got her sealants. So something that I would do differently is showing the pictures of the teeth with this closing solution to my patients so she can see what areas she's missing when she's brushing her teeth. Something interesting that I experienced was that my patient mandibular lateral incisor, they were both never erupted, but it's not noticeable at all. Thank you everyone for watching my video and I hope you enjoyed it.